Hey guys, it's Derek Z, physical therapist here. In today's video, I'm going to be talking about exercises to help with lumbar degenerative disc disease, which I call DDD for short. DDD refers to low back pain that's associated with age-related degenerative changes, particularly the lumbar spinal disc. That essentially becomes a pain generator. So the key structure here with DDD is the spinal disc. And the spinal disc is these structures that are in between each vertebrae that creates a space. One of the functions of the spinal disc is shock absorption, as it shock absorbs axial loading. So it basically absorbs compression. When you're standing upright, it basically allows you to do those things. When we age, the spinal disc dehydrates. As it dehydrates, it decreases in height. And then when it decreases in height, your ability to shock absorb actually decreases. So all the other structures that are around it, especially the facet joints in the back, the muscles and the ligaments that are in this area, they have to compensate for it. So the load goes there. The facet joints are these tiny joints on top and on the bottom of each vertebrae. And what happens is, as the spinal disc decompresses and the ability to shock absorb goes away, the forces go towards these facet joints. And when these facet joints take on additional load, they compress. And when they compress and they rub up against each other over time, they can develop bone spurs, and that can be a source of pain in itself. Now, one of the other structures that the stress and load goes towards when the ability to shock absorb decreases from the spinal disc are muscles and ligaments. You have ligaments and muscles surrounding the spine. It's a very resilient structure that is able to take on a lot of load. So what happens is when you have these muscles in these areas, that's really the only thing that we can influence as physical therapists. So it really isn't a problem when the load gets dispersed. That in itself really isn't a huge issue, as the spinal disc degenerates, because that again happens to all of us. It's one of the normal trajectories of life. At the end of the day, if you have a strong core, you have good muscle control, these muscles, they have good resilience, it's not really a huge issue. It becomes an issue when people don't have that. They don't have the capacity to take on that additional load. The muscles are not strong enough, they don't have good control of their core, then that becomes dysfunctional. That's at that point where exercise comes in and play a role, because exercise plays a direct role in increasing your capacity because it makes you stronger at the end of the day. So this is where I'm going to show you a set of range of motion exercises to help improve mobility in the spine, especially if you're on the tighter end. And then right after that, do another set of stability exercises to help stabilize it. So you always want to maximize your mobility in the range that you have control over, and then do some stability exercises to kind of have control over that entire range. So let's get right into it. So the first exercise is called lower trunk rotations. I call it LTR for short. Very simple exercise. All you're really gonna do, you're gonna lay on your side with both your feet together, and you're just gonna keep your hips and your knees together, and you're gonna rock from one direction. You're gonna hold it there for a little bit, and you're gonna rock to another section here, and you're just going back and forth, just like this. Now, if you're doing this and you're not really feeling that much of a stretch, it means you're just more flexible. You have more mobility. So another way to do this is to straighten out one leg, take one hand, and then bring this down. And as you do that, you should feel more of a stretch. And you can just hold that for about 10 seconds here, and then you go and do it to the other side. And you're just rotating. You also want to make sure your arm's on the other side, so you're kind of counterbalancing the stretch. So you're kind of elongating both directions here. Same thing, you're kind of just going towards the other side. So lower trunk rotations. And when you're doing this, if you're still not feeling a stretch, Another way to do it is to go on your side, drop this knee down, and then you're just opening up to one side as far as you can go. And then you would do the same on the other side. You would feel much more of a stretch. So these are just progressions of each exercise here. There you go. And you're just opening that up. So that would be your lower trunk rotations progression from here. If you're feeling a stretch here already, you can just stick with this. If not, you move on to the next one, or you go towards the other side. And if you're feeling a stretch at all, that way at all, you do the more aggressive version, which is the open book. Okay? So at least that will give you some options and variety to choose from. So the next one is called the piriformis stretch. It's a muscle that's deep in the glute. You're working on the flexibility of that specific muscle and some of the muscles that are around the glute. You're in a hook lying position to start. Get into a figure four position. You take this knee and you pull it towards the opposite shoulder. So you're just pulling it in a diagonal line. You should be feeling it on the right glute. That's where you should be feeling that stretch. If I do this on the other side, just for demonstration purposes, so you guys can see, you're pulling it towards the opposite shoulder. So left knee to right shoulder. And if you're doing this right, I'm stretching my left side, I should feel it in my left glute. That's one way to do this. Another way to do this, still you're in the hook lying position. If I wanted to stretch my left piriformis, my left glute, your left side is the one that's in the figure four position. And then you're reaching between your knees here, and then you're just bringing that up. And if you're doing this right, you should be feeling this on the left glute. So that's another way to stretch that out. This second one is a little bit more aggressive. Also, when you're doing these stretches, because it's a mobility, you're just holding it for a longer period of time. You're shooting for like 30 seconds or so. So the next exercise here is called single knee to chest. So you're gonna bend both knees, and you're just gonna bring one knee towards you, hold it for a little bit, and you're just gonna switch. You're gonna bring the other knee towards you. And again, remember, these are mobility exercises. You're just trying to increase range of motion. You're trying to go to end range, and we're really just stretching. Get it to a point where you're comfortable, hold it there for a little bit, and then relax. Same thing. Get it to the point where you're comfortable, hold it there for a little bit, and then relax. And again, if this is too easy, you can go ahead and bring one leg up and then bring the other leg up. So now this is called double knee to chest. And same thing, hold it for a little bit and then relax. Remember, when you're doing these, you should be going and working towards a pain-free range. If it's a little bit uncomfortable, that's okay, but you shouldn't be pushing past pain. So double knee to chest. So that's the second one. Now that we have some range of motion work in, it's time to get some stability work in. One of the most rudimentary exercises in physical therapy is a pelvic tilt to help you engage your rectus abdominis in the posterior tilt position. So this is basically called a posterior pelvic tilt. So in this position, you're in a hook lying. Another way to kind of cue yourself to make sure you're doing this correctly is to take your own hand, put it underneath your low back, take your low back and press into your hand. As you press down into your hand, I want you to tilt your pelvis towards you. So if you're tilting your pelvis towards you and you're pushing down into your own hand, as long as you're pushing down into your own hand, you're getting that motion to happen. And when you do that, you're engaging your abs. You should feel this tighten up. You should feel that engage. You're just holding that 10 seconds. You're doing that 10 times. So if I'm doing it without my hands and I'm doing this, pushing down, engage the abs a little bit, and then relax. Pushing down, engage the abs a little bit, and then relax. So once you kind of get this down, this exercise is pretty rudimentary. So it's basically just teaching you how to engage your core while you're in this position. Really, the challenges come from when you engage the core and then you move the legs with it. So the progression from here, you're pushing down, engage your core, make sure it's nice and tight, pushing, making sure your low back is flush against the table, and now you can use your legs to distract you. making sure you're still pushing down and keeping your core nice and tight. That's a nice progression from here. So now you have your legs to distract the stability of your core, which then you're really just challenging your abs at this point. The progression from there, to make it even harder, you can take one leg, engage the core, take one leg, and then straighten that out, tap the heel on the table, and then bring that up. And then you can switch. This entire time, you're engaging your core. So you're taking your low back and you're pushing it and making sure it's flush against the table. The hardest part is to probably at this point where your leg is nice and straight, that's probably the hardest part to engage the core, because then now the moment arm is longer. And then there's many different variations, but I'll let you guys work with these for the time being. So the next one up is called bird dogs. This is a nice stability exercise in terms of the rotational plane, what we call the transverse plane. So what this exercise looks like is you're in the quadruped position, so you're on all fours, right? So before you even start the exercise, you want to make sure you're in a good position. Good position meaning like you want your shoulders and trunk about 90 degrees, you want your hips and your knees in relationship to your trunk, also about 90 degrees. So you want to be squared, in other words. So to do this exercise, you're kicking one leg out. Okay, when you kick the one leg out, you're straightening out the opposite shoulder here. So opposite leg and opposite arm. Okay, and then you hold that for a little bit, and then you do the same thing in the other direction. Opposite leg and opposite arm. My biggest thing when you're doing this is you want to make sure you're not overarching your low back, okay? You're kind of making sure you're nice and straight. Another way to tell when you're doing this, which is actually a pretty hard task to do, is to put a water bottle right over here, which then allows you to arch your spine or curve it to a point where you're able to hold the water bottle there. This teaches you what an anterior pelvic tilt is and what a posterior pelvic tilt is. And really at the end of the day is to get your spine to move back and forth. And putting the water bottle there forces you to neutralize your spine. If you can hold that there and still do these exercises, it's pretty impressive for you to be able to stabilize your spine. That means you have pretty good control of your core. Now for the progression of this bird dog the progression is pretty straightforward. So you get into the position here. So you see, look at my bottom foot there. The progression is lifting that bottom foot out. So the minute I lift that bottom foot out, your base of support has narrowed even more because there's less point of contact on the ground. The minute you put this down, it becomes way easier, particularly because now there's more points of contact on the ground. Give that a try. Let me know what you think, and we'll move on to the next one. So the final exercise here is essentially a side plank, so creating lateral stability in your core. We'll start with the modified version and we'll kind of progress to the long lever version. Modified version is pretty straightforward. You're here in the side plank position. Okay, you're laying on your side. You want to make sure your elbows shoot straight down from your shoulder. Okay, you want your hips, you don't want this to be bent a ton, you want this back, and then from there you just push down and you're just holding this. Okay, you can start with like 20 seconds, kind of see how you go, and then kind of work your way up from there. Do that a couple sets, and then you also want to do this on both sides as well too. The progressed version of this, the legs are extended, and then you're coming up from there. So it forces your core to work a little bit harder for you to hold yourself up that way. Again, work your way up, start with like 20 seconds, do that a couple sets, and then work yourself up. My biggest thing with this is the shoulder. When you're doing this, I don't want you slouched on your shoulder. I want your shoulder engaged. I want you to push your elbow down onto the ground, so then you're really engaging that shoulder and also the core as well too. Remember, when you're doing these exercises, everything is to your tolerance. You should keep most of these exercises in a pain-free range. I mean, if you're stretching the end range and it's a little bit uncomfortable, that's fine, but it should not be painful and excruciating. That's essentially what I'm looking for. All right, guys, let me know what you think about these exercises. Try them out and leave a comment in the comment section below. If you enjoyed this video, please like, comment, or subscribe, especially if you found this helpful. I will see you guys in the next video. Take care.